experience around the world at the UN, but I guess I'm most grateful for his leadership in terms of what a member of parliament should be doing, the kinds of relationships you need to have with organizations in order for us to be able to really put forward the kinds of programs and to be invest in community and invest in the things that work. And I think David's candor on what works and what doesn't work is hugely important, as governments quite often have to just take tough decisions about doing what works, and for us to learn how to do something else for something that's clearly not working, and that David is exactly that person. It is and to have MP Kayabaga here, this is fantastic in terms of her just extraordinary work with Black Caucus as the chair, and her unbelievable advocacy for greater supports, not just for Black Canadians, but for everyone across Canada, just as David said, that if you're going to leave no one behind, that you have to be able to deal with the inclusion of marginalized people, and that exactly is what you do. And I had the great pleasure of being in your riding, and immediately in the meeting just before this, that she immediately was thinking about how this could help in her riding. And I think that this sort of cross-pollination that we get to do as MPs is fantastic, and also to hear from Farah the work that is happening in Edmonton. I think people don't understand that Edmonton is the third biggest Black community in Canada, and that to have your influence there and your organization is really fantastique. And j'aimerais également reconnaître que nous sommes réunis aujourd'hui sur le territoire non cédé du peuple algonquin et Anishinaabe, dont la présence ici remonte des temps immemorial. I just want to say it's such a pleasure to be here. I mean, to think that we could be at the Center for Resilience and Social Development, it's sort of prescient that people understood how important resilience is, that bad things happen to good people, and how do you end up with the resilience that when bad things happen, that you can get beyond that and draw on your best self, and the kinds of supports that this center has been offering for a very long time, and it's obviously fantastic to have this opportunity during Black History Month. I really do want to just thank you, Farah, and your entire team for meeting with us this morning, and for us to learn what you're actually able to do in your outreach into the schools. And I think, as David was saying, I mean, schools, you have to meet people where they're at, but also in that situation that may be quite different, and where there's discomfort, and how do we get people to feel included, and how do we let them grow to be contributing to that kind of inclusion, that we know that whether it's adversity, how do you turn that into the kind of leadership and prosperity that we want for all of the children, and the fact that you are actually working with the parents as well, that actually means that we are doing better. I was really excited to hear about the trauma therapy systems approach, and the fact that your whatever it takes approach to be able to help individuals and families, that thereby help communities, and the fact that the psychoeducation is a fancy word, but I think what we're working on across Canada is the idea of mental health literacy. How do we teach people to talk about their feelings, to be able to name it, and be able to say, and help one another with that kind of conversation about, you look happy, you look sad, you look worried, and to be able to establish that kind of rapport that actually it means that you care, and because you noticed. And so I think that we are trying to find words that help people understand as we move through trying to get mental health into the health system as an integral part, but also what we're trying to do to increase the mental health workforce so that everybody understands that they're part of it, that whether it's their family. And I had great fun last month going into one of the black barber shops in my riding. Its awning says more than a haircut. And we're starting to understand that the black barbers and hairdressers are also part of the mental health team. It's where people feel comfortable telling their stories, and where somebody might be able to just nudge them to navigate towards help. So I think that Black History Month is always about celebrating the cultures and the incredible achievements of Black Canadians, but it's also about us drawing the strength of people looking after one another. I had heard from one of the leaders that that at the beginning of the AIDS epidemic, that the barbershops were the places that came together to talk about safety and protecting yourself and being able to be part of the solutions. And I think that, again, the kind of unusual suspects that we need, that you with psychoeducation are getting on the team of being able to say you're all helping create the situations for change and inclusion and again mental health. So we know that sadly that far too many Black and racialized Canadians continue to be subjected to, I guess what they say, a lifetime supply of racial injustice and discrimination simply for being who they are. And I think after the murder of George Floyd, I think a lot of us felt that we're moved by those placards that said the system isn't broken, it was built this way. And I think that when we realize that the state sanctions discriminations of slavery and of colonization are therefore places where we really need to be intentional about how long the system has worked this way and really what we have to do to deconstruct it. So, toutes ces expériences négatives entraînent des répercussions à long terme, que ce soit un impact sur l'accès à l'éducation, d'un manque d'emploi ou de sécurité de logement, ou encore même de problèmes de santé mentale. I think you live every day the fact that for Black youth, the challenges are even more complex. With academic expectations, financial stress, or other stressors further contributing to mental health and substance use challenge. De plus, nous vivons encore une période exceptionnellement difficile où de nombreuses personnes connaissent encore des difficultés liées aux impacts de la COVID-19. It is, we know, and the reason in 2021 that we set up this fund for the populations that were more disproportionately affected by COVID-19, that we actually had an opportunity to actually stop and prevent these injustices to continue. This could be a place where we start again. And so here's the drum roll. This morning we are announcing an investment of $365,000 to the Centre for Resilience and Social Development for your project to support the mental health of Black youth in Ottawa. This unique project will promote resilience in Black communities by improving access to culturally informed mental health support services for Black youth, and by increasing the awareness, as you're doing among the educators and community members, about the challenges and facing Black and racialized youth today. Ceci contribuera à réduire la stigmatisation, à faire tomber les barrières et à façonner un avenir plus égalitaire pour tous les citoyennes et citoyens d'Ottawa. It is, I think, we've seen a little bit of an opportunity with COVID, that maybe people are a little bit more comfortable talking about their feelings, talking about their stresses, and that maybe that has begun to let the stigma go down a tiny bit, and we need to take advantage of that now, before the stigma goes back up and people once again are uncomfortable talking about mental health or substance use. So as the Prime Minister announced last week, we are also committed to working collaboratively with provinces and territories on shared health priorities to improve the integrated health care for Canadians. As I believe that these new agreements have the opportunity to actually transform our universal healthcare system by integrating patient-centered, trauma-informed, culturally relevant mental health and substance use throughout all aspects of the care. Ces accords permettront d'améliorer l'accès à la santé mentale et au support de dépendance pour le biais des soins primaires et d'améliorer les données et le partage des informations de santé entre les professionnels de la santé. We believe that the agreements can also help us reduce the substance use harms, prevent overdose, reduce stigma, and help save lives. We believe, with your help, that we can develop the kinds of indicators that will show us really that these investments are indeed making a difference, and we would love your help on all of that. We know that more needs to be done, and we will continue to do, as you said, whatever it takes to ensure that all Canadians, including those that have faced injustice for far too long, have access to mental health and substance use supports they need to thrive. So Ottawa is known for its multiculturalism, openness, and religious diversity, but we can't take these for granted, and I think that you have the best member of parliament to be able to just continue to make sure all of us understand that. But it is about us working together, everything in our power to maintain this identity and continue to build a future where everyone has equal rights and opportunities, whether that's in the workplace or in our schools. Je suis certaine que le Centre pour la résilience et le développement social nous aidera dans cette tâche importante. It is, I think, as the Black Caucus reminds us, that even though we are celebrating Black History Month this month, that we actually have to make sure that supports and encouragement and celebration are championed throughout the entire year, not just this month. Encore une fois, j'aimerais remercier le Centre de nous avoir accueillis et pour tout ce que vous faites pour servir les jeunes d'Ottawa et leurs familles et pour encourager le changement nécessaire. Thank you. Merci, Miigwech. Are you going to? Yeah. Do-si-do with Arielle. Yeah.
I guess I am now. I'd like to introduce my colleague, Arielle. I'm just going to call you Arielle. Arielle was recently elected, not too recent, but she has been an incredible addition to our team. She's a born leader, and she brings a vivaciousness and a personality that is second to none. And so when she speaks, people listen. So you have in Arielle a very strong advocate. I know that when she speaks, I listen. So why don't we all listen? Arielle.
Thank you so much, MP McGuinty, for hosting us in your riding. It is a pleasure to be here. And he said he listens, but he's listening because I'm asking him advice, and he loves to share advice with me. So, and it's a pleasure to be here with my colleague, Minister Carolyn Bennett, who is a great champion, not just of mental health and health for Canadians, but for everyone, especially for women in politics. And I'm so honored to continue to work with her and to sit with her, to grab on her wisdom. She's been serving for a long time, and she creates space. And I don't know if she notices, I like to find her where she's sitting in Women Caucus at times and sit next to her. And she's actually really funny too. So if you guys don't know that, get to know her. She's a very, very funny person. It's a pleasure to be here this morning. And I just want to start with saying Happy Black History Month. I felt like I'd forgotten that it was Black History Month, and I think it's a good thing because usually Black History Month, I always feel like I'm rushing through the 28 days to make sure that, you know, we did the right thing, we celebrate the right people. And this year has been different for me. I've actually been turning down a lot of speaking roles for Black History Month because I want to be invited in March. I want to be invited in April. And I wanted, like she said, we believe that Black Canadians are part of this make up the mosaic of Canada. And our history should be celebrated all year long. But what a pleasure to be here and to see the work, the amazing work that you guys are doing. I was chatting with the good folks here this morning, and I said, I want to bring this back in London. Because like Carolyn mentioned earlier, in 2020, when we had the George Floyd, I think it was a trauma. And many people opened their eyes to the trauma that Black Canadians and Black people on the North American continent and across the world have been facing. And I remember we worked on removing SROs and elements that were of trigger for young Black youth. And SROs are one of them in London, Ontario, and there's been a gap that bridges the support that, you know, people who are coming from war-torn countries, conflict zones, can actually lean on to be able to continue to thrive in their environment. And I think this is a really good I think the whole country should know what you guys are doing. And I think this should be replicated across the country because I know I'm interested to bring into the city of London, Ontario. And in my role as the chair of the Liberal Black Caucus, I have the opportunity to engage with Black Canadians on many issues across the country. And one of the issues that often comes up is mental health resources for all Black Canadians, Black mothers, Black youth, Black men. And there are so many ways that we can invest in a culturally informed way, in a trauma-based informed. And when it comes to addressing mental health in Black youth, it's really important because those are the people who grew up to become our leaders, our teachers, our bankers. They're everywhere, right? So if we're hitting at the grassroots, I think it's really important because we are actually setting Black Canadians up for a future that is of thriving. And it's an unfortunate reality that Black people in Canada face additional barriers when attempting to access healthcare. So it's our responsibilities as leaders of this government to address this inequity, to create more accessible spaces for anyone who's facing these kinds of barriers. And that's why I think that this announcement today for the Center of Resilience and Social Development is really important. The Center's project will aim to promote positive mental health among the Black youth here in Ottawa, but it will have a trickle effect across the country. And by creating access to culturally informed mental health support services for Black youth, we are setting up a generation of healthy Black Canadians. So I'm really excited to see what you guys are going to do with this project. I'm sure I've chatted with Farah earlier, who said he's been in this service for 16 years. And I'm just learning about it today. But I hope that this is the beginning of many more people finding out about this and finding ways to support you. And I hope that what you're working on, what you're building within the schools, especially targeting the younger generation, can become bigger and can be something that everyone across the country can use. Et en permettant aux jeunes noirs d'accéder à ces services de soutien en matière de santé mentale adaptés à leur culture, la nouvelle génération est préparée à une santé mentale et un bien-être positif. Donc j'espère que ce projet ira très loin. So this announcement of $365,000 of $100 million investment in support projects that promote mental health and prevent mental illness in populations that have disproportionately been affected by COVID pandemic. Our government has continued to support this kind of important work, and this announcement is a proof that we are committed. We're committed to listen to you, to take what you're saying to us and to turn it into announcements like this one. So thank you so much for the work that you're doing. As someone who myself, I came to this country as a refugee. I wish this work was being done when I was a student. I have the fortunate path of being here today as a member of parliament, but my journey didn't start that way. And I think that there's so many other young boys around me that could have benefited for that. So as you continue to do this work, I feel I've been sharing a lot of quotes this month because I like reading, and I'm reading a book called The Mental Fight. This book, I've read it like 60 times, I think, and I continue to read it because I learned from our ancestors, from people who fought through this system, that they did it because their mental well-being remained strong, not because the environment was conducive for them to do that, but they found ways to remain strong. And I'll leave you with this thought that Ben Okri wrote in The Mental Fight. He said that there's no exhaustion yet. So we can't be exhausted because the work that is left to do is still so much. The hope that is still to be felt is still so much. And the dreams of our ancestors have not been realized or redeemed. So we must continue, and I encourage you, and as your chair of Black Caucus, we're here to listen and to support you. And thank you so much for the amazing work that you're doing. Thank you.
I told you she was good. She's good. Thank you, Arielle. Thank you. Very sincere, very genuine, very warm. And you and I have to talk. We'll have coffee. Okay, I'd like to call Farah Aw-Osman, my good friend of many, many, many years. Farah has been a prince, a leader, a gentleman, behind the scenes, up front, back, you name it, he's been there. So Farah, just thank you for having us here. Thank you for the work. Thank you for the commitment. I just noticed, too, that $365,000 is $1,000 a day. Over to you, Farah.
Thank you, Minister Bennett. Thank you, our good local member of parliament, David McGuinty. Me and him, we go back for many, many, many years, and he was there for us as a community and as the residents of Ottawa South. Thank you, Member of Parliament Kayabaga, and welcome to Ottawa South and welcome to our center. As you may know, COVID-19 pandemic has disproportionately affected the Black and other racialized communities in Canada. The African Canadian Civic Engagement Council found that Black Canadians are nearly 3 times as likely to report knowing someone who died for COVID-19. The Council also found that Black Canadians are more likely to be in frontline roles, to feel powerless against mitigating the risk of the virus, and they are more likely to say they have been negatively affected financially by the pandemic. As a result, the mental health of Black and other racialized youth and their families have been disproportionately impacted by COVID-19. Racialized communities, including our agency, have long advocated for better access to mental health services, and the need of these services was described as magnified by the pandemic. Therefore, on behalf of CRSD and other organizations who received this funding, we are grateful to Honorable Minister Bennett and her department and the Government of Canada for funding our projects. 9 projects that support the Black communities, including ours, were funded through Budget 2021, supporting the mental health of those most affected by COVID-19. Our project is called Halumbe. Halumbe is a Swahili word meaning all put together. This project will address the mental health needs of Black youth through individual and group mental health support and interventions in 3 Ottawa public schools, providing targeted training for school administration and teachers in understanding the mental health challenges and the needs of Black student populations, and organizing workshops for parents and guardians of Black youth to address mental health treatment, support, and the reduction of stigma around mental health needs in the Black community. CRSD programming for youth is centered in trauma system therapy, in short TSTR. It was originally developed by staff at Boston Children's Hospital as a culturally appropriate intervention to improve mental health awareness and reduce symptoms of traumatic stress in Somali children and youth in the United States. The model is currently being adopted by the Canadian context for the Canadian context by CRSD, including with the expansion of its applicability beyond the Somali community to other racialized youth and families. And we're very grateful. If I may add a little background about myself, I came to Canada when I was 18 years of age, by myself. I was part of what's called Lost Boys. At that time, there was a civil war in Somalia. It was the beginning of the civil war. And the reason I left was because my elder brother, who raised me and who was a big brother, and like a father figure, if you will, who was a medical doctor, was killed by the regime. And I lost my father, and there was no hope for me to stay in that country. So I left. I went to a Middle Eastern country called UAE, Abu Dhabi, and then through UNHCR, they sponsored me to come to Canada. I came to Canada in 1989, middle of the winter, in Winnipeg, as you can imagine.
You won the lottery.
So I moved to Ottawa in August 1989, and since then I was part of, social service sector, helping newcomers, especially the youth, because I remember what I went through. So for me, it was, a moral responsibility to give back to my community, and I'm grateful that, we have this tremendous team who are trying to assist young people who are going through tough times. We lost close to 100 kids of Somali origin through gun violence across the country, in Edmonton, in Ottawa, in Toronto. So that's why we created this project called Rejo. Rejo is the meaning of hope in Somali language, and we're grateful for federal government of Canada, especially through Public Safety Canada, to fund that project. That project came to an end March 31st last year, but thanks to other departments within the federal government who maintain it and or sustained that project. And this new project will expand the service that we're doing to for our communities, especially the Black community and Black youth and their families. Thank you.
Thank you, Farah. That was more than moving. Thank you for sharing your own personal experience as well. Okay, I think I'm turning it over to Mark Johnson. Mark, you over here, you're going to moderate. You got a quarterback here now, Mark?
Yes.
Is that what it is? Okay, over to you, Mark. And is Minister Bennett and Mr. Farah come together here
Sure. That would
to the
be-
microphone? Do you want to come up?
great.
Just in case
Okay.
you get any questions. And
Yeah,
All right.
but you've said you'll take all the tough ones, is that?
Thank you. Thanks very much. We'll proceed to questions from journalists in the room. Please state your name, your media outlet, and to whom your question is directed. Nous allons maintenant passer aux questions des journalistes ici dans la salle. Veuillez indiquer votre nom, votre média et à qui vous posez votre question. Any question here in the room? No? Okay, on peut passer vers le Zoom. Charlene, over to you if there are any questions on the Zoom, please.
Thank you. Nous allons maintenant prendre des questions de journalistes sur le Zoom. Si vous êtes journaliste et désirez poser une question, veuillez utiliser l'option de lever la main. We will now proceed to questions from journalists online with you. If you're a reporter and wish to ask a question, please use the hand raising function. There's no reporters on Zoom. Thanks, Mark.
Okay, that concludes today's event. Any additional questions can be sent to Media Relations at the Public Health Agency of Canada. L'événement est maintenant terminé. Si vous avez d'autres questions, merci de contacter le Bureau des Relations avec les médias, l'Agence de la Santé publique du Canada. Merci et bonne journée. Thanks and have a great day.
thanks, everybody.
So great. Keep up the great work.